Good evening and hello. My name is Renee D. Waring, and I am the founder of Uniquely and Wonderfully Made Ministries. Welcome to you all, and a special welcome to the new members of my community. I am glad to be able to speak with you this evening. Today, my talk is on youth suicide ages 10 to 24. Quote, the rate of suicide amongst those aged 10 to 24 increased by 60% between 2007 and 2018, according to a report released Friday by the Centers for Disease Control and Prevention, unquote. An effort is being made to understand what is happening and why, according to Anna Mueller, an associate professor of sociology in Indiana University Bloomington, who studies suicide in adolescents. Quote, I don't buy that it's just social media, which is one of the explanations that I most consistently see, unquote. The suicide rate increased from 6.8 per 100,000 in 2007 to 10.7 per 100,000 in 2018. In the last 10 years, suicides become increasingly more common amongst our youth. There are theories on drivers, the rise of social media among them, but researchers say there is not enough data to draw any conclusions. Even though there are increases in the use of social media in other countries of the world, their suicide rates are not increasing. Suicide has replaced homicide as the second leading cause of death amongst youth aged 10 to 24. Suicide prevention experts are very much concerned about the lack of real-time data to better assess trends. They are making decisions about suicide prevention programming for 2021 and beyond using data from the deaths that occurred in 2018, according to Jonathan Singer, president of the American Association of Suicidology and assistant professor of La Jolla University School of Social Work. Public health experts stated that from 2000 to 2007, the youth suicide rate was relatively stable. Late in 2017, however, the U.S. entered an economic recession. During the recession, the youth saw their parents lose their homes and jobs. The youth had to change schools and lose friends. Singer said, quote, my concern is that we will see an increase in youth suicide several years down the line following the economic devastation of the COVID-19 pandemic, unquote. Quote, a CDC survey in August of 2020 on how COVID-19 pandemic is affecting Americans' mental health found that 75% of the respondents ages 18 to 24 reported at least one adverse mental or behavioral health symptom. 25% of the respondents in that age group seriously considered suicide in the 30 days before completing the survey, unquote. Some other stressors are 1, climate change, 2, the economic recession, 3, school shootings, 4, the ever increasing cost of college. Many children's experts say are struggling to imagine their futures. Quote, spotty mental health screening, poor access to mental health services, and stigma may be also the obstacles to getting help to those who consider suicide, unquote. Quote, what is needed is something akin to the National Longitudinal Study of Adolescent Health, which looked at nationally representative sample of adolescents grades 7 through 12 in the years 1994 to 1995 and the 1995 school year and followed them into young adulthood. A study of this kind would help public health experts better understand what may be the driving the increases of how and how to intervene, unquote, said Mueller. Adolescence is a vulnerable time, experts say. It's when children are developing their sense of self, who they are and who they can be. They experience so many changes at once. Environmental and physical changes can weaken safety nets. There are unique circumstances that trigger suicide among different populations. Quote, we absolutely need to be very careful not to think that suicide is just a white kid's problem. It's absolutely not. Kids across social, ethnic, and sexual orientations experience suicidal thoughts, which are not uncommon amongst young people, unquote, Mueller said. Quote, it is fairly normal for kids to have thoughts of suicide at times during adolescence and early adulthood. We need to be prepared to talk about it openly, unquote, Mueller said. If you or someone you know may be struggling with suicidal thoughts, you can call the U.S. National Suicide Prevention Lifeline at 800 273 TALK or 8225 anytime, day or night, or chat online. That number again is 800 273 TALK or 8255. 800 273 TALK or 8255. Crisis Text Line also provides free 24/7 confidential support via text message to people in crisis when they dial 741 741. I repeat, 741 741 741 741. For people who identify as LGBTQ, if you or someone you know is feeling hopeless or suicidal, you can contact Trevor Project's Trevor Lifeline 24 hours a day, 7 days a week, 365 days a year at 1 866 488 7386. That's 1 866 488 7386. Once again, 1 866 488 7386. This information was found in the USA Today, September 11, 2020 edition. The author was Aaliyah E. Dasinger, and the article title was More Young People Are Dying by Suicide, and Experts Aren't Sure Why. Thus ends my presentation for today. It has been a pleasure speaking with you this evening. I hope you found my talk to be both interesting and informative. My next presentation will be on the second Friday of next month. Come join me and invite someone to join our community and watch too. My website is uniquely and wonderfully made ministries.com. UNIQUELY and wonderfully made ministries.com. UNIQUELY uniquely and wonderfully made ministries.com. Go on the site and see my blogs and videos. My email address is mirecovery74@gmail.com. I repeat, M as in Mary, I as in ice, the word recovery, RECOVERY74@gmail.com. I repeat, M as in Mary, I as in ice, the word recovery, RECOVERY74@gmail.com. Send me your questions, concerns, and prayer requests. Invite me to come speak to your group. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Warren, and I am the warrior warring.